Welcome to those of you just joining us. All right, we can see some participants dialing in now. And we'll get started in about 2 or 3 minutes. For those of you who just joined, feel free to use the chat button to say hi. Let us know where you're calling from. I'm going to say good afternoon to our friend Dave Vanderbloemen. Welcome, Dave. And for those of you who are joining us, feel free to chat to us. Let us know you're here and who you work for. And we'll get started in just about a minute or so. All right, welcome to Martha Megan from Chicago First. Taking a break from the heat, says Dave. All right, we have Dean from FHWA Illinois Division. And hi to Eric with G&H International, worked with Edie during Capstone 2014. All right, welcome to Scott Huffman, Indiana Department of Homeland Security. Also tasked with ESF 14, cross-sector business and industry planning and business emergency operations center planning. Good, you're a good place, Scott, to be. We have Robert Chase from Arapahoe County in Colorado. Hope I said that right. And we have Jay Rosenblatt Simpson Wiggle Law LLP in Ontario, Canada. Excellent. We have Art Paul from Delaware Emergency Management Agency. Good to see Delaware in the house today. And we'll get started in just a few seconds. We have some more people joining us. As mentioned, feel free to use the chat and say hello.
With all this nice weather.
Yeah.
I'm glad people are able to join.
I was tempted myself, Tom. Yeah, everyone is muted. I had a question. Everyone's muted except for the panelists. But if you want to communicate, you can communicate through chat or also through Q&A. And welcome to Nicholas. All right, I have Garth in as an attendee, so I'm going to go in and promote Garth to panelist, and then we should be good to go, guys. Let's see. Or Garth, you must be in. Yep, I see you in as a panelist, Garth. Well, welcome. All right. All right, so why don't we go ahead and get started? I'd like to welcome everyone to the All Hazards Consortium Business Resiliency Virtual Discussion Series. This is probably about the 30th or so virtual discussion we've done since the pandemic started. And I think the third that we've done specifically on state BEOC programs. So I wanted to first introduce myself. My name is Laura Johnson. I'm a director of conferences and events for the All Hazards Consortium, a nonprofit organization. I just want to make some administrative comments and then we're going to jump right into it. First of all, we are recording today's session. So if you want to listen to it again, or if you want to forward it to a colleague or industry friend, we will send you the link post-event so that you can forward that along. Feel free to use the chat or Q&A function to ask questions, and we will have time at the end of today's discussion to get to that. So, and not just questions, but any solutions that you may have, any partnerships that came as a surprise to you or worked for you during this past crazy year. So first, let me introduce our Executive Director, Tom Moran. Tom?
Hi, Laura. Thank you. Welcome, everybody. For those of you that are on the East Coast, we have gorgeous weather today. Big change from what we've had here. So I want to welcome everybody. This topic is growing and changing as we speak. You have states that are operating private sector programs, and they're morphing, right? They started as kind of BEOCs, right? Business Emergency Operations Centers, but a lot of them are getting more resilience focused, meaning year-round planning, not just looking at disaster response, but also how do we protect critical infrastructure? How do we do this together? And it all comes down to the same thing as people, it's partnerships. And so we talk about, if you've seen one state program, you've seen one state program. They're all different. They're all unique. And city programs are different than state programs because cities are different than states many times, right? So this is a great dive into how these partnerships develop, the outcomes that result. So we're very happy you could join us today. I want to thank our panelists here that are joining us with Laura, anxious to dive in. So Laura, let's jump in.
Okay. All right, so today we're going to hear from Edie Casella with the Illinois Emergency Management Agency. We have Steve Kalouris, Executive Director from Chicago First. And Steve, I see you brought some of your team here on the line. We have Larry Majelitz, who is the manager with Illinois Crisis Management. And finally, Garth Reynolds, who is the Executive Director of the Illinois Pharmacist Association. So we have developed about 4 or 5 questions we're going to ask our panelists today. But before we go into the questions, I'd like to first introduce Edie Casella. Edie, I want to say thank you so much for organizing the panelists today, for agreeing to do this. And as Tom said, not every BEOC is the same. So if you could take a minute to tell us a little bit about your BEOC and introduce yourself, that'd be great.
Okay, thank you so much, Laura and Tom. We feel very honored and lucky to be part of this BEOC series. It's always nice to be able to know what other state entities are doing, as you said, since there are so many different ways of operating out there. So for Illinois, we dated back to 2007, 2008. And just let me back up for a moment. Prior to that, I retired from the Illinois State Police. My last position was the statewide investigative administrator. And at that time, towards the end of that year, I worked with the Fusion Center, the Statewide Terrorism Intelligence Center, on their Infrastructure Security Awareness Program, which is probably one of the robust partnerships within the Fusion Center environment, and was involved and instrumental in some of the policies and processes that we set up. At that time, also, the Illinois Terrorism Task Force and the Illinois Emergency Management Agency were seeking avenues to explore developing private sector partners. So I was brought on contract to not only work with the Fusion Center, but also at that time with the Illinois Terrorism Task Force and IEMA. So that was a great opportunity, I felt, because even though you're law enforcement centric, you still are a first responder, which brings in the other entities of the first responder environment. So that was a good opportunity. We were a public-private partnership, developing outreach partners and ways to engage, interact, share possible policies, procedures, operating methods with the different members. We, at that time, and still do not put any type of a requirement other than a business address and a responsibility that falls within the environment of a first responder. But at that time, it was strictly that, and I think we were still getting our footing. After that, fast forward to 2011, during that era of 2010 and 11, the FEMA was trying to encourage states to develop what was to be the Business Emergency Operations Center. And though they provided oversight, there really wasn't any foundational documents to base how we operated on or how we should build ours up. And I think not only because of state uniqueness in their operating overall, but also because at that time, there really wasn't any documentation that would have brought organizations to focus more on anything other than how and what does a Business Emergency Operations Center mean in the environment of your state. So 2011 is when we formed ours, and we were able to test it during our state level exercise in the fall of 2011, and that was in a physical setting. We since learned very quickly that even though it's great to have people physically together and really, sometimes some of the better ways, we had to face the fact that people like the panelists with me today have very important, roles and responsibilities within their companies or partnerships, and therefore are not afforded the opportunity to spend the time, which I'm sure they want to spend with us if they could, down in Springfield. So in any event, we've been in that mode of Business Emergency Operations Center since 2011. And the significance I want to add to that is we are part of the State Emergency Operations Center. So that in itself brings the operational influence and provides us opportunities to engage and work with our partners in a manner of response and recovery, besides the problem solving, the planning, and all the other details that may go into forming a partnership. So I feel very lucky that we are in that mode. And we are now also, over the last few years, thanks to the support of our director, Alicia Tate-Nadeau, and our deputy director, Scott Swinford, who have been very supportive of the BEOC. And we are part of the state Illinois Emergency Operation Plan, which hasn't always been the case. And we have our own annex. So that just adds to, I think, the importance of where the BEOC stands in Illinois. So I appreciate that from all of our senior command. In closing, I would like to say that any of our partners could have been here today to fulfill the roles that we have here. Everyone has, it's been a pleasure to work with people over the years, and they all had issues, impacts, and problem solving, collaborative problem solving efforts with us during COVID. But I thought today to kind of exemplify some of the things that stand out based on the questions you asked, Laura, that the power, the energy subsector power, I'm going to call that, we'll be talking about business as usual, not in the sense we normally would have thought initially. And then for the Illinois Pharmacy Association, as the saying goes, during a pandemic or any hazard event, it is not the time to pass and just meet through a business card or introduction. Well, that's what happened, and we can talk about that outcome too. And then three, Steve Coloris with the private sector partnership I consider that a force multiplier, and I hope he does too, to our BEOC partnerships. So we have some partner overlap, but others we don't. So we use that to our advantage based on each of us having our group and knowing each other and working together well. And I might point out, he is our navigator extraordinaire in the Chicago-Cook County area.
All right, Edie, thank you so much for that background. Today, we want to peel back the layers on how the pandemic has changed the way you do business out of your BEOC or with the BEOC program. So let's jump into our first question. And Edie, I'm going to ask you to respond to this first. How did COVID-19 change the way you integrated with your partners, and what challenges did it create for you?
Well, I do think that initially both sectors from the partnership internalized. And that would not surprise you, would it? It's a situation that hasn't been experienced by most. And it probably was best that we looked internally before we offered out, to the other sectors without particularly knowing where we were, where we stood, where we wanted to go internally. So I think there was that initial internalization. But some of the ways we tried to meet the challenge of this pandemic is reflecting back on an event we had just had in Illinois called Crimson Contagion, and to see if that was value added to apply to this event. And it had been a Illinois Department of Public Health and HHS exercise that had occurred, I think, throughout the nation, but and we did participate in that. The other thing is we have what we call our sit reps, or they're called a SEAL, the Significant Event Activity Log, significant event awareness log. It's gone through a couple of name changes. Mm-hmm. So we started by sending out emails that were coming from the public health, just on the expanding positive cases that were occurring throughout the state, in what areas, hospitalizations that they were able to share and document, and the areas where we were beginning to see increases more than others. So we did that as a way of, as you suggested, ways to be able to integrate in the information sharing process. We also did, we looked at what we should do in terms of communication. And I have to admit, we had a scheduled BEOC typical call in March. We ended up canceling that, which I think was internally on my part an incorrect decision. We wish we had it, but used it to the advantage of discussing more about COVID and the impact to the private sector as well as the public, and what that meant to each of us. But we also then did this request for information and to our partners. And we had a significant group that replied back. And what they provided us in terms of information is their concern about the supply chain. And that went much further back than we began to put the information out. They felt it much more into the late fall, early winter, I guess, and early 2000. And they were able to share with us what their concerns were then. Their orders were not being met, or they were being delayed. And then they also talked about implementing their crisis management plans in coordination with their human resource groups and in combination with their business continuity. I think that was a little bit of a new approach for them. And the information was, of course, focused on employees, both from the public and private sector.
Thank you so much, Edie. I'm going to ask the same question to Steve Kalura. Steve, how did the pandemic change the way you integrated with the state, and what challenges did you have?
So I think that just along the lines of what Edie was talking about, when we first started, and let me give a little background on myself first.
Yes, please. Sorry.
Get in. So I'm 2 years with as the executive director with Chicago First. It's a non-for-profit, represents about 32 companies in the Chicago area, and basically concentrating on business continuity, cyber physical security, in coordination with the public sector. So with city and county government, with the state, making sure that all of the business sectors, procedures, and operation plans mesh up well with the expectations of the public sector in any type of crisis or any type of response. So my background before that was 35 years in the public sector. I was retired as a deputy chief with the Chicago Police Department. And during my time there, for the majority of, I was in charge of the Fusion Center, a UASC Urban Area Security Initiative called CPIC, the Crime Prevention Information Center. So I was able to get a lot of background in terms of this type of emergency response or coordination, and very familiar with the whole dynamics of what Edie and I joke around, and I'll say it, Edie, the state of Chicago versus the state of Illinois. And really, when you ask Laura about the coordination or the integration in with the state, that was just it. I really believe, and I hope that I was able to bring a lot of value to the table for Edie and for the state, being able to help coordinate with what the city's efforts were doing. I also sit as the co-chair for the public-private task force with the director, Rich Guidance, of our Office of Emergency Management and Communications group here. So I have that interaction, that guidance, and it was able to just not only from integration of both emergency operations centers, but also from the public sector side, the private sector side, being able to make sure that we talk about what could be accomplished. In the beginning, especially from the private sector side, a lot of it was just the challenges, the looking to move to a remote environment. You know, it was the making sure that everything was in place technologically, you know, cybersecurity wise, and then workplace to make sure they could, you know, accomplish it. And then just like what E was talking about, everything quickly switched to supply chain, and from a lot of different aspects. The city had actually even asked me from a private sector side to help with all supply chain issues. And Edie was great with the state, with being able to coordinate and be able to talk about access and coordination with supply chain issues throughout the state and into the city. So that made a big difference.
All right.
I think that,
yeah.
No, go ahead, Laura.
No, Steve, that's okay. Finish your thought.
No, you know, I mean, it might fit in better after, you know, because I was going to talk about some of the other programs and initiatives that came up as we went through. But, you know, I think that one of the things that we also have to remember too, in the midst of all this COVID during the whole year, it seemed like we kept tag teaming between COVID and civil unrest. You know, it was like nonstop. So although they integrated, there was a lot of complications and a lot of things that made us continually shift gears and reprioritize during the entire time.
Right.
And let's not forget flooding, Larry.
And merge hornets, maybe not Chicago, but
that's correct, Edie.
We manage, yes.
All right, Steve, thank you so much. I'm going to jump to Garth Reynolds. Garth, if you could take a minute to just introduce yourself and go ahead and answer this same question. How did the pandemic change the way you integrated with Edie in the state?
Well, thank you, Laura, and thank you for allowing us to be part of this this panel today. And again, my name is Garth Reynolds. I'm the executive director for the Illinois Pharmacists Association. I've been with the association for a little over 8 years, and but I've been a practicing pharmacist for over 20. And in previous to being with the Illinois Pharmacists Association, I was with Dearborg's Markets in the Metro St. Louis area as their assistant director of pharmacy and head of clinical programming, specifically in adult and adolescent immunization care. And so being here with the Illinois Pharmacists Association, we've been very active with various aspects of state government, and a lot of times on advocating on patient care issues. But we've been working with the Department of Public Health about 3-4 years ago, looking at pandemic preparedness. And we were working specifically of how better to connect local health departments with community pharmacies. And we were working and we helped establish roles and responsibilities for a pandemic. And that kind of led us to the point where we were actually we were a partner participant with the Department of Public Health in the Crimson Tabletop exercise that Edie had mentioned earlier. And so it kind of helped us, kind of go through these processes, but I don't think anything ever really has prepared us for what we've all been through in the last 12 months. I mean, a year ago today is, when we had the declaration by the World Health Organization, and it changed our lives. And so, but because of that, as Edie and I will probably get into a little bit more, this is where things, really kind of helped build partnerships that we may not have had previously. And, we knew who IEMA was, but we weren't involved in any way with IEMA. And we're fortunate enough for those partnerships to have been established and that Edie and I were able to connect, because that's kind of helped us with being able to provide information to the state and to receive information from Edie and her partners as an information exchange, and helping to better inform pharmacists of what's going on, what resources are out there for them. And especially because, as Steve alluded to, not only did we have coronavirus pandemic they were dealing with, but pharmacy was also impacted by some of the civil unrest issues. And we were having to balance those issues and trying to ensure throughout both of these events that pharmacies continued to stay open in a safe fashion for patients and for staff.
And your members, Garth, when they were calling you when COVID first hit, what were they asking your help?
They were really, because whenever everything started to change and everything started to shut down and restrictions, it was more of how do we stay open? How, looking at, okay, what do we need to be doing to change our practice? And this is when we came up with, because CDC guidelines were very vague on that for almost a month and a half after everything started to come down. And even at that point, the CDC still considered pharmacies to be a low exposure risk, which was completely inappropriate. So we were actually developing best practices, not only through our panel of experts, but also working through the National Alliance of State Pharmacy Associations and the American Pharmacists Association to help establish, here's how you need to set your screens up. Here's if you have drive-through, use those only. Try to encourage delivery and getting refills ahead of time, trying to do emergency fills, because we didn't really know what we were going to be dealing with. Was this going to be everyone at home for 2 weeks, or is this going to be everyone at home for 3 months? And so we were trying to strategically get longer refills without taxing the entire medication system, which, we had some interesting events occur where we started to see some of the medication supply chain start to weaken. I won't say collapse, but weaken in the latter parts of April last year. But because of the communication through pharmacies and industry with the state government and with federal government, helped alleviate a lot of those issues because we were talking. And that's the thing, is just the communication and working together is what's helped us succeed here. Now, granted, we still have a long way to go, especially when we get to the vaccines, but I'll pull back on that topic for right now because that's a whole other discussion.
It is.
So.
Garth, great answer. Thank you so much. Finally, our fourth panelist is Larry Majelitz. And Larry, if you can introduce yourself and answer the same question.
Sure, will do. Again, my name is Larry Maglitz. I work as manager of Illinois Crisis Management for Ameren Illinois Corporation, based in Collinsville, Illinois. Ameren, Illinois is a subsidiary of Ameren Corporation that's based in St. Louis, Missouri. We are a combination gas and electric utility, serve a large portion of the state of Illinois, primarily south of I-80. We've got about 1.2 million customers in Illinois and almost exactly the same amount actually in Missouri. Been with the company almost 32 years now, so it's been quite a while. Most of that time, 25 years or so, I spent in field operations in various positions in engineering and then also operations supervision. So, and then now I've been in emergency management for the balance of that time. So I've had the chance to work with Edie on multiple different occasions on different events. So had good interactions with our BEOC without a doubt. I guess for us, I think really one of the major impacts has been just the lack of ability to have face-to-face interactions naturally. And that's, if anything, that's probably one of the, I guess the technology adoption as a result of not being able to have face-to-face interactions has been, if anything, maybe one of the silver linings of this COVID year that we've had. I know we moved a large portion of our workforce to work from home in a really short period of time. Something I think I heard some of our IT guys say, you know, that would have taken us a much longer period of time than just the few days that we did it in. So I guess that's one of the major impacts for us.
Okay, sounds good. Thank you so much, Larry. All right, we're going to jump to our next question. What solutions did you initiate to stay mission ready? And this is in light of COVID in the last year. So Garth, if I can start with you on this question.
Thank you, Laura. And a lot of what we were able to do with staying mission ready, and I think a lot of doing some of those tabletop exercises and being involved with the Department of Public Health kind of gave us a little bit of what we should expect. But as I said earlier, nothing could really prepare us for what we were actually experiencing. And I think the hardest thing for us was being able to not just to keep our members informed. And so we were going through lots and lots of different, information changes, and we were utilizing older chains of communication like email alerts. But I think what helped us get not only ourselves more prepared, but also our members and staying prepared was that we initiated weekly town halls, and that gave everyone a chance in an open forum to be able to have those discussions, to be able to talk about what was going on, what was changing, what they're doing at their practice, and other pharmacists to go, oh, I could try that too. And so this is how we were able to keep everybody at an operational level a lot better than I think we were seeing in some other states.
Sharing of information.
Exactly.
All right, Garth, thank you so much. Steve, we'll jump to you for this question.
My response would kind of follow a little bit in the path of what Garth just put out, is the aspect of communications. A lot of the stuff with the businesses, and a lot of times the public sector kind of forgets the aspect, is that all these businesses are usually facing some type of regulatory issue, some type of coordination that really is important, that on all of the public sector sides, city, county, and state, you have to have that's what they're looking for more than anything, is what is going to be the next executive order, or what's going to be the next change that they have to amend their operational plans to stay fluid and make everything work, and looking out for the safety and well-being of their staff. So that's probably what we did along those same lines. We started to have regular ongoing webinars, meetings. Once it broke away from being able to have any type of in-person, we initiated a lot of different communication sources, and it was across the board, not only to everybody in the private sector, but like I say, Edie couldn't have been more critical and more helpful in terms of making sure that, like I said, as those executive orders were being produced and out, we were able to get it to, critical entities on the private sector side so that they stayed viable in their businesses.
All right, Steve, thank you so much.
And Laura, if I could interject there too, because
Yeah.
Stephen reminded me of one other thing, because when you mentioned executive orders, I mean, there was a number of executive orders that impacted a lot of our industries. But, one of the things that we did to help was to kind of help filter all those in one place. So we actually created a COVID resource center for pharmacies to be able to use, so they could get all of this information from the feds and from the state just in one place, and kind of pull back all the mess so they could see exactly what they needed to see.
And that was so important because information was coming fast and furious.
Absolutely.
Yeah. Garth, thank you for that input. Larry, how about you?
Yeah, one of the things we did, I guess, internally is we established early on there in March, COVID task force, and we had various different folks from within the organization, senior leadership that was involved in that. And we used a lot of the communications that we did receive from the state naturally as the different agenda items on those calls. Specifically, some of the data from the state that we would get with respect to counties, as far as infection rates, we used that to gear what type of operations we would have, and whether or not we would engage in restricted operations, as far as whether or not, our gas folks have to enter homes to light pilots. If we wanted to, or we felt like we needed to restrict that as a result of infection rates in a particular area, we relied on the state data for that that would come to us. Also on the electric side, kind of similar, we would engage in restricted operations in certain counties that became hotspots in Illinois.
Okay. And Edie, state perspective, how did you become innovative over the past year?
Well, once we got outside of trying to stabilize our process internally, It was a question of trying to understand what the needs were from the private sector, particularly from the information sharing and collaborative problem solving side, to all with the intent of, solving issues that could for the public. Now, when Larry brought up the information that he had used to make those operational decisions, which is important to us because that's what we would want. It was through our communications platform that we use, the BEOC, and our partners, if they choose, have access to it. So you can imagine it is password controlled. And so as the event started, we had to make sure that those who had the passwords had to have them update, so there's that little bit of scramble. Wish I had planned better on that, maybe even put out a reminder of training steps for the BEOC. But, that's hindsight, but things that can be applied in the future. I have to admit that in normal circumstances, we do group calls, but we also do individual calls. We have an advisory board that I would call to get the barometer of what is happening and send information out. But it doesn't do any good if you're just passing out, say, numbers that don't have meaning for a specific area. And as Larry stated, once he made clear where their interest lied and why, based on wanting to protect their employees and have awareness in the areas where the hotspots were occurring, it certainly made sense for these essential workers that are public facing and at high risk. So that's for us, we had to change what we would normally have put in our sit rep. And we did daily sit reps that sometimes provided us not only with the state declarations or executive orders that were occurring, but also tried to bring in some of the current events. So people would have an awareness what these companies were accomplishing at a national or within the scope of the state, to see those business to business relationships, particularly in the manufacturing association, over 600 companies strong, repurposing, revamping in the name of protecting the citizens of Illinois, as well as the company essential workers, in finding and being able to obtain PPE, which we all know is one of the hardest things to find. And the list of companies that I served as a conduit for between to make introductions. So I noticed, I'm not sure if it was this question or not, Laura, but you talked about business to business relationships. And I think you saw those things shine, especially in the ag world, where you noticed there was outbreaks, and the manufacturing group was able to work with them to get the availability of the plexiglass, the face masks, and other PPE that weren't necessarily easily attainable. So when you asked unique, I don't know if this is really unique either. The BEOC is always on the edge of donation requests. If the SOC says, hey, could you guys check with the private sector partners? We might need additional water or et cetera. That's usually been the extent of it. There have been times when we maybe ask for different types of cleaning equipment, but we focus more on the joint response from the operational side. But we certainly want to be a part of donations when we can be. But that almost became overwhelming in our instance. One of the people who has a full-time job, it was assigned to help me part-time, and it became almost full-time for her also. So I was very lucky to not be operating by myself, because I think it would have been very hard to accomplish and address the donations that were coming in, that we coordinated with our warehouse and logistics, as well as all the other types of information and resources that we needed to share and provide to the private sector. So after, when I had mentioned, first we did the request for information to really identify where the private sector was, what they were using to make their determinations. We also did the sit rep to keep in the communication. But the particular high point that was so extremely busy, and I think, and I believe Steve mentioned this to me, if I should have done a group call at the time so that's one of those lessons learned, Laura, that when we were talking about the essential worker definition and credentialing for the state, I cannot tell you how many calls a day I took. And I probably could look back on my tablet and give you a number, but it was just amazing the number. And these weren't just partners. These were people who by word of mouth from other organizations and entities or companies was given the BEOC contact. And I think that's really important to know that once again, that business to business side is still working, even in this type of event, to be able to help each other to try and get to the place where information can be shared. Now, I'm not claiming at all that we were the sole source of information, because as you know, with Steve and the Fusion Center from the public-private partnering side, we certainly shared information. But, social media, news outlets, governors, press conferences, other types of press conferences from PIOs and government levels, those were all really good sources. CDC guidance, Illinois Department of Public Health guidance. So I don't know if those were the most unique things, Laura, but they were things that went beyond, say, the normal response and information sharing that we had for hazards. So we certainly pivoted to that. And I didn't know where we were going next, but I wanted to make sure we could get in a couple examples from both Garth and Steve, particularly about what occurred during COVID with the open and closed pharmacy status delivery and how we knew what was open and closed.
Garth, you want to take that?
Sure. Yeah, I'll jump right in that. And in first part, I know Edie was just briefly talking about like being access for information and specifically of equipment and PPE. And that's kind of how we ended up connecting, was that the state was able to get access or information of being able to direct people to obtain cotton masks. And that was at a time when, any mask was almost made out of gold at that point. And we were very appreciative from a pharmacy and healthcare point of view that we were able to connect pharmacies to that information to be able to obtain those. And then that fast forward us a couple of weeks just down the road where, we were dealing with some of the civil unrest issues in the city of Chicago and surrounding areas. And we had a significant number of pharmacies that we really didn't know at that time, were they even operational? And actually, we had an outreach through the mayor's office of the city of Chicago if we could help with developing a list. And I didn't know that at that time that Edie's was also working on some similar information through their operations center. So we were both kind of developing the same information. And this is where, it's like lessons learned now. It's like, if I'd have known that, I would have went right to Edie and we could have linked everything together quicker and got A to B a lot quicker together. But that's what we know now. And we were able to find out, and, but it was good because we had some bits of information. She had other bits. So it all worked. It all worked in the end of helping us ensure that we could provide out there from a state point of view and also from the city of Chicago point of view, so citizens could find which pharmacies were still open or which had limited hours during that time until they were able to get back up to fully operational status.
Thanks, Garth. Steve, anything to add there?
Yeah, Laura. So along the same thing that Garth's talking about, when coming from the public sector side to the private sector side, and talking again about the importance of those partnerships and relationships, Edie and I both kind of got intelligence backgrounds from our times and working for law enforcement and stuff. And, there's a saying, you don't know what you don't know, right? And there's a lot of capabilities. There's a lot of resources that private sector brings to the table that in all my days of the public sector, I never would have thought. Yeah. And my eyes got opened up in what the scenarios are talking about when, just like what Garth was talking, unfortunately, with the civil unrest, there was a lot of impacts to different areas. And geographically, you didn't know what was open, whether it be pharmacies or food sources, grocery stores, or gas stations. And I learned that a practice that's been used in disasters with hurricanes and things throughout the nation with the FSI SEC on the financial sector side, they work with the credit card companies and they do a credit card pull. And they can let those emergency operation centers know exactly who's taking credit cards. So you know exactly who's open, under what time frame, and what's thing, broken down by type of background, whether it's grocery, whether it's everything. That's vital. That's great to be able to bring to the table. And like I say, I learned that just like Garth was talking about what he was bringing to the city. It's that task force mentality and that partnership of cutting through the red tape and bringing the associations to the group is a need that really lead to success and solve problems. So it was, it's great things that we keep learning from each other.
Absolutely. Thank you so much. All right, we're going to jump to question number 3. How did COVID change the way you communicated and or prioritized? And what would make it easier for other sectors or even the state to work with you? So Garth, I want to start with you on this question, if I can.
Sure. Like I alluded to earlier, we've completely changed how, we were mainly just sending out emails or we'd post stuff on our website. Now we have dedicated resource centers for COVID and for other topic areas that are important to our members. But it was really that town hall that really helped. I mean, we were holding weekly town halls, and sometimes they're even twice a week town halls from April up until almost mid-July. And then we were shifting to every other week, and now we're monthly. And our members have given us so much feedback that they love this communication, just having a time just to bring any issues that they're having and ask for just feedback from other members of what's going on. So it has really helped us with being able to engage our members in a virtual sense, where we haven't been able to have any regional meetings. And Illinois being a large state, it's hard for us to get to all of our regional and our local affiliated associations, where we can do that now very quickly and very efficiently through a virtual town hall format.
Absolutely. Thank you, Garth. Edie, how about you?
Well, as I said, we were taking a lot of calls individually, whether it was a representative from an association or a company or a small business. And that was particularly during that period of time where we were still waiting to see what was going to happen with the definition from essential worker. And as you know, the feds came out with the guidance, but that isn't necessarily what the states took strictly. They applied it more to the individual state itself. So that definition sometimes honed in more to some of the subsectors of a sector. And I think that besides being conveyed in written format, it was discussed at a press conference with the governor's office. I wish I probably would have had some conversation, as I said. I'm not going to belabor this point, but I do realize even the town hall situation that Garth talks about, I think this is something that I was used to, the other hazard way of communicating. So we did play catch up though, and do a couple of business emergency operations center calls. They weren't quarterly, but they were certainly based topically on COVID. And some of the speakers included Garth, who gave us kind of like a heads up on the vaccine side. Or we had the critical manufacturing group on there to go and give bring to life the challenges of retooling, revamping, and prioritizing what they need to manufacture to meet the demands of what the country and Illinois was going through. And to hear the executive director, CEO talk, and the audience had a chance to ask questions, hear him talk about those days of what some of the companies went through operating at 25% or even 50% capacity, is really very interesting. And I think that helped with some of the impacts that these companies were going through. So have I always seen the benefit of having calls or in-person meetings? Of course, but I will admit that some of the other responsibilities that we acquired during the course of this event certainly changed us a little bit out of our comfort level of how we would normally operate. And that's probably a good thing.
Sure.
It's keeping you on your toes, helping you learn to pivot. But yeah, the communications, I mean, we used every possibility way, every function and way we could, whether it was entering data into dashboards, emails, calls, certainly pass-throughs from the feds or to the state or to like Steve's group or the Fusion Center group. We just tried our best to have outreach to as much critical infrastructure as possible. And just as a side note on that cloth mask, I mean, that is an icebreaker when you're trying to develop and work with associations that you've never had contact before. So I have to admit, it wasn't just Garth and his group, but there were several of the associations that I hadn't even considered from a partner standpoint. Shame on me. And to have that kind of icebreaker of, hey, we're providing cloth masks, would your association be interested, or members, you know, this is how we would handle it. The response was overwhelming, millions. So.
And moving forward, Edie, what would make it easier for private sector partners or even new companies to work with the state and work in your program?
Well, in the past, and Steve and I were talking about this the other day, I used to travel the state and stop in to either just do a walkthrough if one of the companies wanted to give me a tour, or have a cup of coffee, not necessarily on their site, but somewhere else, or just call passing through. And that physical presence, I think, an interaction, it's something hard to walk away from. And I'm not saying that the virtual side of things isn't effective, but you know, it's that in-person being able to see those body language, you know, facial reactions in real life that I really think helps. And so I do think that the word of mouth of companies to one another and the communication flow that they have business to business was so helpful for them referring companies to us and other partnerships. That was just amazing to me. And I don't want to diminish that. I mean, I realize there's probably smarter technology to make that happen, but in some ways it was what worked in order for them to discover that. Also, you don't have the opportunity as much now. I did a lot of in-person association sessions, different sector representative meetings. Those are things that I participated in. And now, sure, you do it virtually, and I'm not taking away from that, but there's just something there when you leave and you do exchange those business cards, et cetera. So I'm not against technology at all, but I do like some of the old ways we did things in terms of in person.
Nothing can replace that, Edie. All right, Larry, how about you?
Yeah, I too kind of miss those face-to-face interactions, that's for sure. I guess one of the things, I'll go back specifically to different communication means. During the weather events that we had, the more serious weather events anyway, there would be a situation room that would be typically opened up. IEMA would do that, and then we would typically monitor that, and then we can see the other things that are going on by different public entities that might post information there, and then we can post information as well, because as anybody knows, those shared priorities during restorations can become pretty important, such as nothing more than getting roads cleared that need to be cleared. If you got situations where highways are snow covered or drifted shut, and we got some serious customer that we need to get access to, got that way access through the state to IDOT in order to facilitate things like that. So,
All right.
that's something that happened in 2020.
Well,
Right.
I appreciate that, Larry. introduced us. I think there was awareness in the background, but being able to share and be a part of their pre-staging activities during events that were approaching that tended to be the more weather type hazards really gave us an opportunity to understand what they were standing up, where their attentions were, what areas, and our focus from the SOC BOC side could also go in that direction. And Amron, I should say, is probably one of the longest partners who has been with the BEOC from the days of when we just had what I would have called, and I don't mean just, but when we had a public-private partnership, the overarching side of outreach and, meetings and trying to set up, policies, procedures, et cetera. And they stayed with us through the business emergency operation piece. And as we moved to become more operationally, that is really when they began. And then other utilities followed to be able to share their pre-staging too. So that was very important. So thank you, Larry.
All right, and Steve, same question to you.
Sorry, I'm a little slow on the unmute button. I think that the biggest thing that we faced, and this goes like from the private sector side, our communication, just was enhanced with everything on the public sector side with the state BOC and, across all of the public sector partners. But to get the information out, I think this was something important to kind of talk about, is that first off, you try to eliminate too much white noise, because as things kept developing and other concerns came up, being it PPE acquisition or anything with the supply chain or social distancing or anything to do with an executive order, you get the same thing repeated multiple times. And then you're also concerned on the private sector side, there are so many rules with either email servers or with their firewalls over what's getting through and what's not getting through and how the communications are being handled. So in my time back with the Chicago Police Department and the Fusion Center, we had taken advantage of the Homeland Security Information Network with DHS, HISN, and they've got Adobe Connect through there and Adobe Connect dashboards. A lot of times that's the way we made sure that all the fusion centers across the country were all communicating and talking in this type of environment. So I just took that and I brought that into Chicago first, and I actually brought it into the Chicago EOC. So we stood up dashboards. At any given time, if we face some type of crisis, whether it's civil unrest, whether it's the COVID dashboard, we've been up with the COVID dashboard probably close to a year now. And it was one of those things that when we first presented it and talked about it, the private sector was a little hesitant on it. They weren't too sure about it. Now it would be difficult for me to take it away from them. And what it provides is not only resources like what Garth was talking about with information that they can get, but it also provides an opportunity for them to go peer to peer and be able to chat and communicate and talk and keep that networking going, whether it's anything they're facing or what they're looking for. And they can talk to public sector members that we invite into the room and are allowed there. So I think that was a major aspect of communication and prioritization. I mean, I think any of the panelists here would say that the prioritization of everything changed on a monthly basis. It was what was the biggest fire burning right now. And that's just even talking about COVID. We had to transition so quickly and so often that it was always trying to be innovative and find the best ways to succeed.
I don't know how you guys slept, how you got your sleep in. All right, we're going to move on to our next question, which is similar to the one before, but deals with coordination. How do you coordinate with states that don't have a BEOC? So this is for our private sector. So Steve, if I can start with you on this one.
Sure. So, again, I would tell everybody to try to take advantage of that situation. If you don't have dialogue with those BEOCs, first off, Edie was always great. If I needed something, I mean, I remember beating her up a couple times with questions from Michigan or from Wisconsin or Iowa. She would always be able to reach out and get that information. But that Fusion Center network, that's this experience that I also bring to the table, and it's another avenue, it's another resource. Edie talked about the partnership and the integration between her efforts and the STIC, the State Terrorism Intelligence Center in Illinois, when it started. A lot of times those relationships are there. that's another great resource to be able to talk to and develop partnerships and relationships that you can reach out to them and be able to get additional information. Also, likewise, in the private sector, a lot of times these businesses, they're not local just to your municipality or to your state, they're national. So you force multiply those resources and bring that into play on what information you can pick up from those businesses of how they're operating their continuity plans or disaster recovery plans in those other states, and bring that experience and that knowledge back to everybody local.
Great answer. Larry, Steve was pretty thorough on that. Is there anything you want to add about what your tricks of the trade are to coordinate with other states?
Not since I'm specific to Illinois, not really, Laura, I guess. And I'm not familiar enough on the Missouri side with the person that does the emergency response activities in Missouri to know whether or not they've got that in Missouri to interact with actually.
All right, that's fine. So I'm actually curious about our listeners today. So I'm going to launch a poll. If you could take a minute to look at your screen. What, if any, is your role with your state's BEOC? So we'll give this just a few seconds to answer our poll. Okay, I see some bunch of answers coming in. Interesting, so far, my state does not have a BEOC, is in the lead, which,
Oh, wow.
yeah, surprises me, but we're still waiting for a few answers. We'll give it a few more seconds before we close our poll. All right, let's take a look at what we have here. So we have about 14%. I am only active with my state's BEOC. About 20% I'm active with many state BEOCs. 7% I am not active with any BEOCs. My state does not have a BEOC was 36%. And I run my state's BEOC is 20%. All right, great. All right, so before we jump into Q&A, I'm going to ask all of our panelists to give their one little last bit of advice to our listeners today. And Edie, we'll start with you. Are there any recommendations or resources that you would recommend to our listeners to help them improve their resiliency and their relationships, their public-private relationships?
Well, a little bit is from the preceding question. I do think that there are companies now who have territories other than in one or two, maybe states in the Midwest or something. I have had numerous calls from either corporate headquarters in Illinois or companies that have assets in Illinois that have said, is there a clone of you somewhere else? Well, hopefully there's not a clone, but you know, the roles
doppelganger.
the roles and responsibilities of that type of position where they then would know who to call during events. Because let's face it, they can cover a whole country and internationally too. And even though it is frustrating maybe to recognize that you do have to cover each of these states individually, the important thing to remember is that these states have these type of jobs and they can really help you. So if you ask, you will probably be able to be provided a list of who those other entities are. And then also, I want to compliment Tom and you, Laura, with the All Hazards Consortium, recognizing and building out the interactions, responsibilities, opportunities to solve problems with the state private sector liaisons. I also want to put a plug in because NEMA has worked with the private sector liaisons also. So I do think those are opportunities for companies to recognize and have a list depending on where their territories or assets are, because I do think it is resourceful. And, Larry, you may not look at it this way, but, just you trying to get out of state at times, if it wasn't for what you were able to get from the fleet working group in those other states, you might be bugging me. So I'm kind of happy. No. So he may think of me, but he also now knows to go to stop shopping with you guys. The other thing I wanted to add, besides state liaisons who do a terrific job, and all of us it's important to get to know us too, because we're in different stages of our partnerships, as well as we operate in different capacities, and understanding that would be helpful. Also, I'm thankful to have had the private sector annex in our emergency operation plan for the state. It helped us from the state liaison side to understand interactions with the partners, and also vice versa with the partners themselves. And one other thing I would add from a recommendation standpoint, it's never too late, and maybe you should always be taking a look at how diverse your list is of your partners in the BEOC or public-private partnership arena, and to recognize what's out there, which is amazing to me, in types of associations, as well as companies and businesses that are all important to building your relationships and keeping businesses operating too. So I do think that is a serious one to take into account. And as I am the first to admit, I've added numerous companies and associations during this event. So, and just when you think you have a robust event covering all sectors, you learn you don't. So I think that's a valid point.
That's great advice, Edie. Thank you so much. Steve, what would be your advice for our listeners today?
Well, I would say really, in order to really have good quality public-private relations, you start at local and you grow it out. So, be it at a city level, county level, you work on building there, and then you integrate outward so that it's strong. But make sure that you've got representation from all the sectors and all the subject matter experts that can really help you. Edie threw it out there. That's Chicago First mantra, is that a crisis is no time to exchange a business card, right? If the train's left the station, you're in trouble. You're gonna be playing catch up. You're gonna miss it. So really making sure those relationships are established. In the same way Edie said, sometimes that's just calling and talking to somebody about the wife, the kids, the significant other, anything. Just so you're keeping that network open, and you have some conversation. It's important. It's important to keep building on that. The resiliency aspect, I don't want you to drop a quarter in the jukebox, and I'll ramble too long, but one of the things that really opened my eyes, being a public sector child and coming into the private sector, the challenges that we really put on them. Edie was talking about a lot of these businesses with Chicago First, more than a handful are international, but when you look at it,
I think he froze.
Okay.
Yeah. Steve, you froze. So I'm going to go ahead and jump to Larry. Same question, and we'll try to get Steve's connection back.
Okay. Yeah, I'm going to reiterate exactly what Steve was saying there as far as those relationships go, because even if you don't have a BEOC in your particular state, you probably do have some sort of emergency management agency. And those kind of contacts are really important from a utility standpoint because of those shared restoration priorities. And it really doesn't matter if it's a weather event. It could be a train derailment. It could be another utility situation. It could be civil unrest. All the information that can be exchanged there it can be really important to a utility or an entity's response. So establishing those relationships definitely ahead of time and those contacts is pretty important. Like I said, whether or not there actually is a BEOC in your state.
That's right. Steve, sorry about that. It looks like we have you back. We had lost your connection for a sec.
Yeah, I'm sorry about that. I'm not sure 100% which part that I disconnected on, but what I was going to say was that with businesses across the country, they have multiple locations, and like Tom had talked earlier, right? You've seen one state plan, Well, unfortunately, in today's day and age, there's still that type of disconnect that you're looking at business continuity plans, evacuation plans, everything. It's not like there's a cookie cutter for credentialing and stuff across the country, right? Everything is different. And, what I really hope that as we, continue and proceed, lessons learned from everything, we kind of get better uniformity, and that, it can spread out into more of a national picture. And thank you guys for doing this. Things like this help that.
Thank you, Steve. Garth, we'll end with you. What would be your last bit of advice to the listeners on the line today?
I think really when it comes to recommendations and resources and everything, it's kind of bridging off what Steve just said. We really have to look at crisis emergency management and crisis management. And I think a lot of times in pharmacies, we center on a lot of other aspects, but we don't always say we need to focus on this in case of emergency situations that evolve us into these type of scenarios of A through Z. And I think, working with partnerships like here with the BEOC, and also with other departments and other partners, because there's many other partners, many pharmacy partners that are part of the BEOC in addition to IPHA, that we can help develop standards that not only Illinois can use, but other states can use. I was just at another meeting where I've been encouraging other state pharmacy associations that aren't involved with their BEOC to start that process, to engage with their EDs, so they can know that the great partnership you can build as we have been able to do here. So it's more of, we gotta take up the lessons learned here and prepare for the next one, because there will be a next major issue that we'll have to overcome.
There always is one, isn't there, Garth?
Laura, I just had, if I could quickly put in two comments with what Garth brought forward, a perfect example. And I think examples are good for people to understand that we are talking about actually situations that occurred. But when one of the groceries pharmacists stood up in Illinois and had said at these sites they would have the vaccination, apparently the system was down because the vaccine hadn't arrived. And there was so many inquiries from the public or from others taking different routes on social media. And I was able to reach out to Garth and say, who from this group is the one that can be able to get to the heart of this, resolve it, and make sure people understand, don't be discouraged. This is just a question of how it's being purported because the vaccine hadn't arrived yet. That doesn't seem like a big deal, but it certainly was a big deal in that area when they had been counting on the vaccine. So I think that was important. And a couple of other resources that I think I have mentioned earlier, but I would be remiss not to mention again, is certainly the FEMA and BEOC and the continuous meetings they had, as well as CISA. I appreciate anyone who is willing to provide information of value and effectiveness for public-private partnership relationships.
Edie, thank you so much. I'd like to thank you, Edie, for pulling this wonderful panel together. And to the panelists, Edie, of course, Steve, Larry, and Garth, the input was great today, and I really appreciate your time. I realize how busy you all are. So thanks for everything that you do for Illinois and for the nation. For those of you who have questions, we have a little bit time left. So while you are entering your questions into the Q&A, I'm going to ask Tom to say a few words about our SICE. Tom? Tom, you're on mute.
Thank you. Some of my best stuff goes into the mute button, right?
Yeah.
Many of you may or may not be aware that the private sector in 2015 approached the consortium about establishing a legal framework to protect information for a lot of different reasons. Well, one of the reasons for that was in Maryland, a 501c3 is exempt from FOIA. So that's very comfortable for states and regulated utilities to be able to talk and plan and argue and discuss and fight and solve solutions outside of the realm of media and things like that. So they created this thing called the SICE. It's a legal framework. It goes through a vetting process. It's free if you want to register for it. It's siceusa.org, siceusa.org. But what the SICE does, it creates a framework where in specific problems can be like a honeycomb. Specific problems can be offered up like a cell. And inside that, the right people and information can be put in there, and we can create products and dashboards and things like that. That can range from this Uber PPE model they developed that aggregates procurement in minutes, right? That was one they did very quickly. They've got a number of them in transportation. We use that for a number of reasons, but it starts with the basic vetting of people, and that's what the SICE is about. So if you'd like to join that, we invite you to do that. We have a newsletter and things that go out periodically, but it's a way for government and industry to start coming together and work as they start building trust. And I think that was the underlying thing all of you said, and I've seen it. You can have all the technology you want like that, but trust is a funny thing, and it develops faster when we're face to face, right? Virtually, we're working out better to do that. But if I trust Laura and Laura trusts Edie, the chances of Edie and I trusting each other is elevated dramatically, right? But nothing like face to face. And so we have to work in both environments like that. So anyway, we just invite you all to be part of that, and that continues to grow. Anyway, I want to thank you. Before I get a chance, I want to thank all of you for jumping on here. I made a bunch of notes here I was writing on and off about other potential use cases that could come up or work on, or topics we could do for other webinars. So anyway.
Yeah, that's a good point, Tom. If there's anybody on the line who has an idea for other topics they want to see, or even those that they'd like to be a part of, please send us a note through the chat, or you can email Tom and I. My email address is coming up on one of the slides right after Q&A. We did have a question about technology, and I'll throw this out to anyone on the panel. Did you leverage any technology to validate, aggregate, and publish data to provide your COP to the private sector? And how did that work for you? So anyone want to answer that?
Edie, you're muted. Same as me.
Okay, I thought I was done. You know me. So I was going to say we were able to provide the GIS information visually in terms of test locations, hotspots, what was happening in a county, statewide. All sorts of where what type of test site it was. I mean, and it's flowed into the vaccine rollout also in terms of information sharing. But they have done that through the different technologies, which I won't name specifically, but I'm sure all of you know from the GIS world, where they excel and have been intimate in how we've been able to convey the information in a visual manner. And Larry was alluding to that, or if not stating it clearly, excuse me, that that was what they used for their information. So it may be posted in Web BEOC, but it's as an attachment, and and then we did have some dashboards also. So, and that was at a state level as well as what we used at IEMA. And I think, Steve, if you're still on the line, you certainly had mentioned the different dashboards you used, and I was invited to during the COVID era, but during the civil unrest, which was really important in giving us an idea of what was happening north of I-80.
Thanks, Edie. That was the only question that we had. So again, thank you so much to our panelists, and thanks to everyone on the line for dialing in for this today. We do have some upcoming events, and we will make sure that we send that to you via email as we did for this event. And my email address is laura.johnson@AHC for All Hazards Consortium, USA.org. If you, again, have any questions or ideas for other webinars. We really enjoy doing these. It's a great way to meet all of you. Yeah, go ahead, Tom.
Before we drop, Edie teed something up. We're going to plan a webinar. I want to plan a webinar, Edie, with all of the state liaisons from the 14 states on the SICE State Liaison Committee, right? Let's get that out there and help people and promote those programs. So that was a really big one.
Yes, I think that's very much needed.
Yeah, and because I think half the time the private sector, I think Steve, you said it, there's companies that are local, there's companies that are regional, there's companies that are national. And one of the things that it's hard from a national perspective is to know who those folks are in these various regions. But I find if you know one of these 14, you can get to the rest. It's kind of funny, you know, California, Arizona, Chicago, these strategic are wonderful. So stay tuned for that one. The other thing I think would be interesting is to peel into the, from Chicago First standpoint, we've had a number of requests about credentialing. And I know Steve, Chicago First did a really good one, okay? This is a topic I can tell you that is very difficult for the private sector to get their heads around. Why can't we just have a national credentialing thing? I've been at this for a long time, and that's a big reach for a state, right, to do. However, there are principles I think we can pull from that would help this, right? So I think that was one I made a note on. So that was really good. And I think the other thing too, Larry, you mentioned was the concept of mutual assistance, right? A lot of states don't understand mutual assistance and how that works. We've got states on the East Coast saying nobody leaves our state until all the power's on. Now that sounds good to the ignorant, okay? I can say that because I'm not a regulated utility. But those people don't understand if they do that, they become an island, right? Because the mutual assistance thing is a volunteer thing. It's so powerful, right? And I've explained it to a couple of states. Once they realized what that was, now how can we support mutual assistance? So that could be one we could maybe get into later, because that affects everybody. I mean, that's a difference between power coming on Monday versus Thursday.
And you know,
Okay?
Tom,
Nobody wants that kind of delay. So this was really, really good. And I just want to thank you all again for taking the time and our audience for joining us on probably the prettiest day of the year. So that's it.
Okay, Tom, thank you. And this ends our webinar, but we do have a few minutes left. So if there's anyone on the line that wants to stay connected, we're going to go ahead and promote all of the attendees to panelists. So you can go on screen and say hi to our panelists or ask any questions that you want to live. For everybody else, thanks again for coming, and we will send you a follow-up email. Have a great evening. So I'm going to go ahead and start promoting our attendees to panelists if you want to stay on.
So this is our virtual happy hour.
okay, that's one of those where I think I do like the more in person.
It's so funny, Edie. Everyone has been forced into this virtual environment overnight. I think, Larry, you said it. I mean, people had to go in the office and out of the office in hours in some cases, mostly days. The good news is we had a massively flexible comms network that supported all that. Think of that. Okay, I think we had some bumps in the road. I think when everybody had to go virtual and we had schools, right? And so schools were virtual, companies were virtual, everybody's virtual. So there were periods of time when things were down, but it was pretty amazing. And now the question is, how do we connect, right? And build trust, if you will, in a virtual environment, right? And we're searching best practices for that. One thing that seems to be a constant, I'd love to hear your all thoughts, but one thing we find seems to be a constant is people connect very quickly in a problem-solving environment, right? That seems to be one thing that gets everybody focused. And I trust Steve when he's helping me solve this problem together a little more than when we just talk about what we think, right? I mean, you all know what I'm talking about, right? So I don't know what you all find, but that's kind of what I've seen. I'd love to hear your thoughts about connecting, if you will, through in a virtual environment versus face-to-face.
And I promoted everyone. So if you have an input to Tom's question, just feel free to unmute yourself or come on screen. We'd love to see you. I see our friend Bethany Elliott is here. Hi, Bethany. And then Scott Huffman, you had a, hey, Bethany, how are you?
I'm great. How are you?
We're well. And Scott, I think you had a question and I wasn't sure whether to answer it privately, but if you want to clarify, we can help you out.
Yeah, this is Scott. I work with the Indiana Department of Homeland Security, so right next door to many of you. So I'd like to get communicating with, Edie outside of this as well. But something that I found with my stuff, because I've been in mass care, I've been in continuity and volunteer and donations management. Each one of them has a set of groups that have the ability to communicate with other state liaisons. And I think Tom mentioned something like that just a minute ago for this kind of state coordinators. Because I'm new to the BEOC, ESF 14, public-private partnerships, and I'm constantly trying to learn more. And best practices, I'd rather learn from those that have been there instead of trying to recreate the wheel. So I was just wondering if there was an organization out there or a group setting that we can share that kind of stuff and have monthly calls or quarterly calls.
Scott, I'm sorry, you're with what state and what agency? Forgive me.
Indiana Department of Homeland Security.
Okay.
So I
Very
deal
good.
with all the continuity of operations for all the state agencies, and I've been working with some of the private sector for to help that. So it's really lend itself towards this role, but yeah.
Got it. Okay.
What do you think, Tom? Zeiss?
The answer is yes. I'm just trying to think of where. There's a couple thoughts. One, does your state have a emergency management private sector liaison or a PIO?
Well, I'm in the emergency management section of our Homeland Security.
Okay.
So
Okay.
yes, I know all of the participants of our emergency operations team, and I work in the EOC once or twice a week. So yeah, I know that.
So okay, good. So Edie, I'm thinking maybe we tie Scott into the liaison, relationship, because especially if you're a state employee,
Yes.
right? In the EOC in a state.
Yes.
That would be my first
So I
thought.
sit in the ESF 14 desk and the planning section chief desk of our EOC. So depending on what role is needed, I mean, right now it's very limited because we don't have any information sharing dashboard. Speaking of Steve's dashboard, I've been wanting to recreate the NBEOC as a portal. I've talked about maybe having a web EOC side of it like Edie just mentioned, but that's a lot of maintenance and oversight that would have to go into that. So
yeah, that's probably step 5, and I think you're on step 1.
exactly. I'm just learning the partners right now and the processing.
Okay. I would think the consortium state liaison group would be probably a good one. Certainly connecting with Edie would be great. NEMA, National Emergency Management Association.
Yeah.
If they've got a group that meets, I think Edie monthly, be a good resource.
And also FEMA Region 5, Scott.
Yeah, I'm on those calls when they have them.
Okay, just so you know. Okay, good. I'm usually on them too, so I don't know if see, it isn't clear to me, I guess, I did not know. I remember when you had sort of a privatized side of the private sector that worked in conjunction with your SCSC, because I did a joint exercise with Indiana at that time.
Yeah, we had Mike Alley, which was a or business resiliency group that fell through several years ago.
Okay.
There was some other trouble. I mean, Mike's a great guy, don't get me wrong. I've worked with him many years. It's just that never took off past that point of that exercise. So we're trying to redo that.
Yeah. So.
But you do have some sort of a relationship that's coordinated with the private sector, correct?
Yes, I work with the Midwest Contingency Planners Group.
Okay.
So I do have private sector liaisons, not liaisons, but counterparts.
Okay.
So the other thing too, Scott, register with a SICE, and we can get you plugged into some stuff I think will help you. One of the things that we try to tell everybody in state government, if you want to kickstart your program, have a meeting with a company or two and ask them what they need help with.
Yeah, I've already
Okay.
talked to a couple of my
And
contacts, like at Roche Diagnostics
there
and
you go. And
Cummins and some of those places, because I want to know what they would have liked to see from the emergency management side. What can I provide them as information, and give
this
them
is
the opportunity to ask me.
the best programs in the nation started with government asking industry, what can we help you with? They all started that way. First, private sector would step back like, oh, that's new, right? Now can I trust you? And as they solved the problem together, then they went to the next step. That's how North Carolina, probably the most prolific program in the nation, one of them, that's how they started. So you can do that in Indiana. You don't need a formal program. You just need a conference call, right?
Oh, I
You can't
understand
get,
that.
yeah. So
I have quarterly
anyway,
meetings with my state continuity working group, and I've been
perfect.
inviting my private sector there for a while. So because I tell them we're all in this together.
So anyway, register for the SICE. I'll connect up with you, plug you into that. But no, hey, we're glad we're glad you're able to join. I mean, that's the whole point of this, right? Awesome.
Thank you, Scott. Anybody else want to unmute and ask a question before we adjourn? We're happy to hear from you. Any good jokes?
Hey, we got to see your puppy, Laura.
No, he's sleeping.
Laura's got a new, I don't know, 8-week-old golden retriever. So
Challenging, Laura.
What'd you say, Edie?
I said challenging, huh?
Very challenging.
one last thing is we just had our annual Resilience Summit, and the next one is coming up in January, 25, 6, and 7. It'll be virtual. I got to give props to Laura and the team that really pulled that together. 31 sessions, 60 speakers, covering a lot of ground. The reason we went broad, right, was to find those things now that we can go deep into.
Yeah.
So
Scott, that would be another great resource for Scott and others who want to hear from private sector and public sector partnerships and what worked and what didn't work. And like you said, Scott, getting one central source for that type of information. We have concurrent sessions. It's pretty comprehensive. I know that's so far away, but we also have recorded all the sessions from a month ago, so that you have access to that through the SICE.
Well, and I think one of the things the SICE working groups always looking for use cases they can drill in on, right? For example, they have a number of them. And when I say a use case, it's really a problem solving thing. So one is, here's one, a good one, cyber attack during an election, during a hurricane. Power's out, elections tampered with, false information. That was the scenario. How do we respond, state, federal, and commercial? How do we coordinate right a boom after a cyber attack that takes down the grid, right? This was the product out of that was getting a directory of state contacts from 7 state agencies. This was a use case came to us from the electric sector, and we worked it with our states. So that was one. The second one they're working on is coordinated damage assessment. How do we leverage the SICE to have a utility and a state share their damage assessment data on one screen? And they're doing it right now as a pilot in Virginia with Dominion and the EOC. We've got a number of other problem areas we're working on, but that's the whole point of the Resilience Summit, is to look at some of these use cases next year and how we're moving them forward. So if you have an idea, okay, send it in. There's a number of them, but it's all about coordinating public-private. Could be a training initiative, could be a problem-solving initiative, and these webinars give us a lot of those ideas. Probably one of the best ones we had last year, Laura, if I'm not mistaken, was how do we get ready for an extended power outage?
Right.
And there was a book written by Infogard. It's on Amazon. You can buy it. Probably the best product I've seen in my entire career of extended power outage, what causes them across 12 sectors, what you can do to sustain from them, the planning you can do. Is one of the best books I've read ever. Powering Through, it's called. But we had them on a webinar. It was the biggest webinar we had. We're going to take a couple of those and drill down into those. So what does that look like in a city, right? What does 3 months with no power look like in a city? Chaos, right? So this is kind of the use case process that the SICE working group is developing. So we invite you all to be part of that.
Yeah. So thank you everyone for dialing in. Hopefully you got some valuable information out of it. I know for me, it was super fun. Thanks so much to everyone in Illinois. We appreciate all of you. And stay safe, everyone. We'll see you next time.
Thank you.
Thank you.
Oops.